Hello. My name is Jones, and today we are going to look at how you can choose your nursing care diagnosis. Okay, apart from this, we are also going to look at how to come up with a nursing intervention. Okay, so as you are nursing a patient, how do you come up with the interventions? Okay, so now, once you have analyzed your assessment data and selected the most obvious nursing diagnosis for your patient's nursing care plan, you should review each area of possible need to ensure that you have not missed an important area. One way to conduct this review is to keep in mind the acronym RNS Hope. Okay, so we are looking RNs, like registered nurses hope. Okay, so this one I've just tried to coin it and trying to simplify how you can choose your nursing care diagnosis, because a lot of people in their training and sometimes in practice they have problems in coming up with the nursing diagnosis. Okay, so when you're looking at the RN's Hope here, it covers a lot of areas of basic needs. So the letter R is for rest and activity, N is for nutrition, S is for safety, H is for hygiene, and P for psychosocial. Okay, so that is to do with the psychosocial needs and the likes. Then E is for elimination and education. Okay, so in the RN's Hope, here you can have a lot of nursing diagnosis phrases that you can make, okay, based on the same. Let me try to give some examples under the rest and activity, which is the R part. So examples of nursing diagnosis that are grouped under the rest and activity may be activity intolerance. So when you're looking at activity, rest and activity, here, activity intolerance becomes one of those nursing diagnoses. Okay, so with this, please, I would also want to mention that I've done a lot of presentations on how to come up with a nursing diagnosis and other things that you need to add. So here, this is just a phrase or part of the nursing diagnosis without the other components that are there. So these are like nursing problems that we are discussing. And for it to form a diagnosis, you need to add issues of related to, evidenced by, and the like. So here we are just coining the problems that can be there before you put the evidence and the related to part. So under rest and activity, we have impaired physical mobility. We have problems like fatigue. We have problems of like sleep deprivation, which you can write due to or related to, and then pain, which may be acute or chronic, also affect rest and activity. Okay, if patient has got a fracture, you just know that rest and activity is affected. Okay, even a patient who is depressed, you know that rest and activity, those are affected. So this is how you can come up with the nursing problems in building up to your nursing diagnosis. Okay, so I've made emphasis that when you are now writing a nursing diagnosis, you need to write evidenced by or related to. So these that we are coming up with, these are the problems. Okay, so this is the root part of your nursing diagnosis, which is the problem. Okay, so now this takes us to the other part of our N, which is N, nutrition. Okay, so nutrition is part of how you coin up nursing diagnosis. Okay, so the problems that are under nutrition include risk of impaired liver function, imbalanced nutrition, less than body requirement, self-care deficit, due to problems of feeding, okay, risk for constipation, okay, risk of unstable blood glucose level, impaired swallowing, or fluid volume deficit. Okay, so when you talk of risk, when you're talking of nursing problems, you know, they are what we call potential and actual. So when something is put as a risk, then you know that this is just a potential problem and not necessarily an actual problem. So when you talk of risk, mostly you don't, or you should not put evidence by, because it is a risk, so those things might not be there, might not be present. Okay, if they are now present, then it means the actual problem is there. Okay, so to do with the nutrition, other problems that you need to note can be nausea, okay, or risk of electrolyte imbalance. So all these fall under the problem of nutrition when you are coming up with a nursing diagnosis. Okay, so now we move to S in the RN's hope, and S, okay, it encompasses problems to do with acute confusion, contamination, risk for contamination, readiness for enhanced comfort, risk of injury, impaired physical mobility, risk for infection, impaired skin integrity, risk for impaired skin integrity, risk for peripheral neurovascular dysfunction, impaired verbal communication, hypothermia, risk for falls, impaired memory, and wandering. Okay, so all these form the root problem of your nursing diagnosis and safety. Okay, in the RN's hope, the next letter that we are looking at is H. So some of the root problems that may form your diagnosis and hygiene include readiness for enhanced self-care, self-care deficit. Okay, so self-care deficit may be in relation to toileting needs that the patient may need. Okay, and then a self-care deficit can also be to do with dressing, and self-care deficit can also be to do with oral care or bathing. And hygiene also, we have impaired oral mucous membrane, okay, that may come as a problem of hygiene, as the patient may have what we call foul breath or halitosis. Okay, so in the other hands hope, we have dealt with H, and then we move on to O, which is oxygenation. So there are problems that may come to do with oxygenation, okay, that form the root of your nursing diagnosis. So some of the problems may include ineffective airway clearance, risk for aspiration, risk for decreased cardiac tissue perfusion, or ineffective breathing pattern, and then you can also have impaired gas exchange, or ineffective peripheral tissue perfusion, or decreased cardiac output. So these are some of the problems that may come under oxygenation, forming the root of your nursing diagnosis. So in the RN's hope, we have dealt with E, H, and O. Now we are dealing with P, which is for psychosocial needs. So under the psychosocial needs, we have ineffective coping. Okay, we also have readiness for enhanced decision making. Then we have a risk for compromised human dignity. Then we can have interrupted family process. We can have a problem of fear, anxiety. We can also have a problem of disturbed body image. We have also other problems that include ineffective health maintenance, impaired home maintenance, readiness for enhanced hope, or you can also have problems to do with moral distress. We can have problems to do with the readiness for enhanced power, or chronic low self-esteem, or patient may have under psychosocial as a problem of spiritual distress, or may also have a problem under the psychosocial, which is social isolation or stress overload. So these are some of the root problems forming your nursing diagnosis under the psychosocial area. All right, so in the RN's hope we have dealt with P, and then now we're dealing with the last part, which is elimination and education. So the root that will form your nursing diagnosis under elimination and education may include areas like constipation, urine retention, urinary incontinence. Okay, then may also have problems to do with urinary incontinence that may be because of issues of stress, or under elimination there can be problem of diarrhea, or we can have problems of bowel incontinence. Other problems may include self-care deficit because of poor toileting needs that the patient may have because of the disease. Okay, so under elimination, also the problem of fluid volume excess or deficit may come in because of issues of diarrhea. And then under education, that is elimination and education, is the issue of sexual dysfunction may come, and also the problem of deficient knowledge, which is very specific to education. So in trying to remember the root that form your nursing diagnosis, it is important to use the RN's WOP. Okay, the RN's WOP, registered nurses WOP, here where we have talked about when you are coming up with a nursing diagnosis, look at these roots of the nursing problems that has to do with rest and activity, that has to do with nutrition, that has to do with safety, hygiene, oxygenation, psychosocial, and elimination, also education included. Okay, so with what we have just discussed so far, it's important to remember that many nursing actions are used to prevent problems, and in this event, these actions are grouped as the risk for or nursing diagnosis. So the three most areas a student most overlook are self-care deficit, deficient knowledge, and the major reason is that the patient is in the hospital, such as a patient having fractured hip, so that patient is going to have impaired physical mobility, or may have myocardial infarction, and such a patient may have decreased cardiac output. Okay, so in addition, each medication to be administered and each procedure to be performed should fit under the nursing diagnosis, okay, and the plan of intervention are put in place. Okay, so now with this discussed, let us now try to understand how to come up with nursing intervention in our nursing practice. So intervention form the largest part of your nursing care as you write, whether it is a nursing care plan or as you are doing your general nursing care. So it forms the backbone of nursing, and the team nursing intervention tries to describe any action that the nurse may take to improve the health and the comfort of their patient. For those are considering advancing, like in the field of nursing, intervention are really a crucial aspect in advanced nursing, like when you're doing your master's in nursing or when you're doing your doctorate in nursing. So intervention formed that crucial concept. So when you say a nursing intervention, according to the Journal of Nursing Education, nursing intervention can be described as one of the two ideas. Okay, so the first idea is any task that a nurse does to or for a patient, and then the other idea is that anything a nurse does that leads directly to patient's outcome. So these tasks may be general or specific and direct or indirect. Examples of areas of patient care intervention include sleep pattern control, mobility therapy, compliance with a diet, infection control, alcohol abuse control, positioning therapy. Okay, it can be bed-bound care or energy conservation and postpartum care. So in addition, a patient-focused care should also take in consideration the actual or potential deficiencies that the disease may pose to the body or system. Okay, so namely, we have the integumentary system, skeletal system, muscular system, nervous system, endocrine system, cardiovascular, lymphatic system, respiratory, digestive, urinary, and reproductive system. So when you're coming up with your nursing diagnosis and nursing problem, bear in mind how these systems have been affected. Okay, so you know that all these systems need to work very well for a patient to have balanced health. So apart from this system being affected, an individual does not exist in a vacuum. He has a certain dimension to balance well-being. So research has shown that a balance among the 7 dimensions of well-being leads to fuller, more satisfying life. So the 7 dimensions include the dimension of physical, intellectual, environmental, vocational, social, emotional, and the spiritual health. So in as much as you would want to look at how the systems have been affected, okay, it is also important to look at how these dimensions are affected when you're coming up with your nursing diagnosis and your nursing tasks. Lastly, also here I would want to say that during the illness there may be potential or actual deficiencies within the 12 activities of daily living that were proposed by Roper-Rogan and TN model of activities of daily living. So this entails that apart from the systems of our bodies are being affected, we should look at the dimensions that I mentioned that can be affected by health in coming up with our nursing diagnosis. If not, then we also need to look at how activities of daily living have been affected. So the activities of daily living include maintaining safe environment, communication, breathing, eating, drinking, elimination, personal cleansing, okay, mobilizing, waking, playing, expressing sexuality, and also issues of sleeping and dying. So we need to critically look at how these have been affected. However, nurses may work in specialized settings like ICU, that is intensive care unit, oncology, pediatric, which may require knowledge of specific intervention that may be unnecessary in other areas. Although every nurse may not be familiar with every intervention, the concept remains universal across the field that you need to look at all these. Okay, so when you're writing your nursing care, these are some provisions that you can always look at in the NANDA, where he has tried to propose some of the interventions that problems that you can identify. So NANDA came up with a lot of nursing problems that you can look at when you're coming up with nursing diagnosis. Okay, but in trying to simplify all the dimensions that sometimes, okay, maybe even NANDA has mentioned, I've tried within this discussion in talking about RN's hope, okay, because it is not necessarily feasible that even if we were to talk of all interventions, and one nurse is going to master all the interventions, because certain interventions may be necessary according to the patient's condition. So here in my discussion, my emphasis is just necessarily on the the simplified RN's hope in coming up with your nursing diagnosis, or in coming up with the root problem as you write your nursing diagnosis. So thank you very much. We have really looked at how to come up with your nursing diagnosis, and also we tackled the issue of nursing intervention. Okay, so please, I would encourage you to also listen to other lessons that I've also recorded on how to come up with a nursing care plan. Okay, and also look out for some of the books that I've written, and some yet to be published. So I've included this information because I feel it's essential, cardinal, and a simplified way of helping practitioners and those that are still training on how their work can be simplified as they are working to come up with a nursing diagnosis, and how to come up with a nursing intervention as they are helping out our patients out there. So thank you very much, and please keep studying. Hi family, I welcome you to this lesson. We'll look at nursing care plan. Alright, I cannot cover the nursing care plan in isolation without necessarily looking at the nursing process. And to fully understand this lesson, it's also important that we also have a lookup on the data that you get during assessment in order for you to come up with a nursing care plan. And that is the subjective data and the objective data. You cannot completely understand the nursing care plan without full knowledge or division of adjectives and adverbs. To write the nursing care, you also need to know the activities of daily living, because they help us or constitute problems that you may identify in a patient. And sometimes the problems that we identify in a patient may come from the body systems that have been affected. All right, so to start this lesson, let's look at the nursing process and what it is. The nursing process is a deliberate problem-solving approach for meeting a person's healthcare and nursing needs. Although a lot of authors have come up with different steps on how the nursing process is supposed to be written, you will notice that words like assessment, diagnosis, planning, implementation, and evaluation, they come out strongly. And it's important that you understand these terminologies very well for what they mean. So when you say assessment, that is the systematic collection of data to determine the patient's health status and identify an actual or potential health problem. The analysis of data is included as part of the assessment for those who wish to emphasize its importance. And analysis may be identified as a separate step in the nursing process by other authors. All right, now let's also look at diagnosis. What is a diagnosis? Please, there is what we call the doctor's diagnosis, which is malaria, diabetes, and the likes. Now here, we're looking at the nursing diagnosis. What is a nursing diagnosis? Okay, so when you look at the nursing diagnosis, the construction, the doctor may have one diagnosis, but the construction of the nursing diagnosis constitutes a lot of problems that might have been identified in the patient. When we talk about the diagnosis, there is identification of the following types of patient problems. The nursing diagnosis, which is actual or potential health problems that can be managed by independent nursing intervention. And we also have collaborative problems, but certain physiological complications that nurses monitor to detect, or that is changes in patient's health status. Nurses manage collaborative problems using physician prescribed and nursing prescribed interventions to minimize the complication of the events. So that is about the diagnosis. The nursing diagnosis needs to be based on the problem that the patient is facing. All right, let's look at the other item, which is the third actually in line, is planning. What is planning? Planning, when talking about the nursing process, we are looking at just the development of goals and outcomes, as well as a plan of care that is designed to assist the patient in resolving the diagnosed problems and achieving the identified goals and desired outcomes. When you see in our nursing care plan table that we have written, there is no planning. We have just put objectives. Okay, that is the planning part of the nursing care plan itself. All right. Apart from that, there is implementation. Implementation is the actualization of the plan of care through nursing intervention. And when you look at our nursing care plan there, we have nursing intervention, and then we have rationale, which has been written as RAT, nursing intervention also written in short form. Then the last part there, which is the fifth step of the nursing process, is evaluation. When you say evaluation, this is the determination of patient responses to the nursing interventions and the extent to which the outcomes have been achieved. I hope that is clear. But otherwise, there are many different ways in which we would define the nursing process. I, for one, I look at it as a systematic approach or a systematic and organized method of planning and providing quality and individualized nursing care. Others may look at it as synonymous with problem-solving approach that directs the nurse and the client to determine the needs of using care, to plan and implement the care and evaluate the results. Others may look at it as a goal-oriented, organized and systematic humanistic care for patients and effective provision of nursing care. Those are the many assumptions or ways in which people may look at the nursing process. All right, so with that said, I'll move on and maybe necessarily talk about the diagram of the human being that I've written there behind on the board, if you analyze the board. I've written a human being and I've written certain things like anxiety, okay, social, skin, cognitive, nutrition, okay, communication, breathing, and the likes. I looked at this as a simple way or form of trying to portray the problems that the patient may face so that I make it easier for you to understand. Most of the problems that the patient may face, if you look at my corner there, I've put strands FBICA. So maybe social, may have to do with the skin. Okay, so there I've just tried to simplify or condense the problems, bubbles around the patient there. So all in all these things that I've tried to put around this patient, they are coming from activities of daily living, breathing, eating, and the way systems might be affected. Which systems? Cardiovascular or the digestive system. So the strands FBI CA is actually more of an acronym of all those problems around the patient. The social, communication, and then you see that I've also put R, which has also been represented within the bubbles that the patient has in my diagram. Insert nutrition and the S of the skin or the social part, and then other starts to do with the way the risks or the risk or relations that the patient may have. And then we have the CA there, FBICA to denote fluid breathing, immunity, and the likes. But I hope you analyzed the board and you know you have understood what this is all about. So whenever you are thinking of writing the problem that the patient is facing, look at the strands FBICA. This is the CA that will help you to understand or come up with quickly problems that you're going to write within the nursing care plan. Of course, that is dependent on the diagnosis of the patient. But otherwise, because of that, there is also a pattern that you can still look at. The pattern here of coming up with the nursing diagnosis are PE, RM, BC squared, and K. So in this pattern, I'm trying to build up for a formula that I've tried to propose within this presentation on how best you can write an essay plan. So P there is for perceiving. Okay. So perceiving, E is for exchange, R is for relating, M is for movement, D is for valuing, C is for communication and choosing. That is for C is for communication and choosing to, and then N is for knowing. These values, when someone has been admitted, they are affected, and it makes it easier for you to come up with problems. Maybe let me just give you a little bit of examples under the same values and how they can be affected. So under the pattern, under the pattern of exchanging imbalanced nutrition, okay, risk of imbalanced nutrition, risk for infection, risk for imbalanced body temperature, ineffective thermoregulation, that is to do with exchange. And then if we have to look at communication, impaired verbal communication, that is a problem that you can have. And to do with relation, we can have social isolation, impaired social interaction, risk for loneliness, and ineffective low performance, or impaired parenting. Those can be some of the problems that can come under relating. Under valuing, there is risk of spiritual distress, readiness, or that is readiness for enhanced spiritual well-being or spiritual distress that may come. I can imagine, because of my religious beliefs, then I'm admitted in a hospital where they serve me pork, and I don't eat pork. They serve me beef, and I don't eat beef because of those religious beliefs. So you should know that there are also values that can be affected, and that constitutes a problem. Okay, then under choice or choosing, we have ineffective coping, impaired adjustment, defensive coping or effective denial, disabled family coping. So those have to do with choices or choosing. All right, and then apart from that, we have the pattern to do with the movement. That is impaired physical mobility, risk of peripheral neurovascular dysfunction, impaired walking, impaired wheelchair mobility, or impaired transfer mobility. All right, if you look at the pattern of all these problems that I've tried to identify you under the PAM BCK, you see that there are certain qualifier weights that have been used. And I want to give you a glimpse actually of certain qualifier weights that you can constantly use when you're coming up with a nursing care plan. What would be those? And how does it simplify your writing of nursing care plan? So qualifier words that are added to a diagnosis label or problem statement to gain additional meaning may include words like deficient. So the word deficiency will mean inadequate in amount, quality, degree, or insufficient or incomplete. Then we have words like impaired, which means made worse, weakened, damaged, reduced, or deteriorated. Words like decrease are also used to mean lesser in size, amount, or degree. Words like ineffective are also used to mean not producing the desired effect. So those are some of the qualifier words that you can use in order to qualify your problem very well. You look at the bubbling under that human being we wrote there, and then you also use those qualifier words. You look at the activities of daily living, and then you use those qualifier words based on what has been affected within the patient. Look at the body system, see what has been affected, then you use those qualifier words. With that, I know you saw that I've wrote the word adjectives and adverbs there. Most of the English that we write in do with the nursing care plan, a lot of people argue to say it's not correct English. And I'm also thinking of recording lessons to do with nursing English. Adjectives are necessarily words that define or give more meaning to a noun or a pronoun. And when we talk of a proverb, it's so an adverb. It gives meaning, more meaning to a verb and also to an adjective. And these lessons can be learned in the lessons that I'm going to post to do with the nursing English. Okay, so it is mostly the problem, or why people find problem with this is mostly the syntax. Oh, when I use the word syntax, I mean just a fancy way to mean the combination of words. That is what is wrong in most cases. So with that said, let's also look at the nursing care plan that we have tried to draw there. This nursing care plan, I came up with it on the 9th of January 2020. And we have the problem identified was that was a 02. Of course, that's the time when I was developing this. That's the time when I was developing this lesson. That's when I was recording this lesson. And then we have the nursing problem. We have the nursing problem. Okay, so the nursing problem there is impaired breathing. The word impaired is being used to define or give more meaning to what is happening to breathing or the process of breathing. Impaired breathing. The word breathing can also be replaced by the words gaseous or gas exchange. Impaired gaseous exchange. Ineffective gaseous exchange. Okay, that is to do with the nursing problem. So now, we have to look at the nursing diagnosis. And there's a formula actually now for this. We are coming up with a formula to write the nursing diagnosis. So in my formula for writing the nursing diagnosis, I just have the PE and the PES. So you may say the nursing diagnosis may have 2 parts or may have 3 parts. P for the problem, E for the etiology. And then when it's PES, S will be for the symptom. So when you say PE, when you're writing the etiology, you write due to or related to. Then you're giving us the etiology. The etiology, once again, just means the cause. And then when you're writing the symptom, you give us the evidence. The evidence will be that symptom or the sign and symptoms that you're saying. So that's the definition. So that now constitutes the 3 parts of the nursing process. Okay, so our problem was impaired breathing. So even when you're now writing the diagnosis, first you have to write the problem. Impaired breathing. After you write the problem there, impaired breathing, then this impaired breathing, it's related to or due to what? It's related to increased bronchial secretion. Are you able to see the bronchial secretions? No. What is the evidence? Increased mucus production. We are seeing it in productive cough. This patient has impaired breathing. How do we know that the breathing is impaired? Mostly the patient is using accessory muscles. Patient is using accessory muscles, that will be a sign that there is an impairment in the breathing. All right. Then there's also some arguments that sometimes people bring across to say we have actual and potential problems. So when you say risk of, there can be no evidence. Okay. You risk getting malaria. You risk suffering from malaria. The evidence is you not using a mosquito net, not using a repellent, and the likes. You risk dying in an accident. Why do you risk dying in an accident? Because of overspeeding. You risk getting caught. Why? Because of acting on the other side of the law. All right. So now, I do not want you to perceive things the way I see them. Whenever you have a risk, then there is no evidence. If that's the way you want it to get it, okay. But I just wanted to put my way of thinking across. When there's risk, there's no evidence. Or when there's risk, is there evidence? You can debate on and on and on. Okay? So when you say there's a risk, just give us the etiology. When you say it's a potential problem, then give us the evidence. It is okay. There's no problem with that. All right. Then, if you are good at writing nursing problem, and now you're also now feel comfortable at writing the nursing diagnosis, then we have to look at the objective. The objective needs to talk about the problem that you have, but now we are looking at the certain action that will help improve at the problem that we have. So we are saying is to increase tissue oxygenation. Tissue oxygenation helps to solve the problem of an impairment in breathing. And if the patient is not breathing well for a long time, then we can easily lose the patient. So we need a time frame. Hence, our objectives needs to be smart, but is specific, measurable, achievable, realistic, and it should be time bound. So within 30 minutes, we want to increase tissue perfusion. All right, so that is our objective there. Then we can now look at the nursing intervention. The nursing interventions here that we have is to give oxygen to the patient, the required liters of oxygen, because that improves perfusion. The evidence of poor oxygen perfusion may also be the cyanosis in the pelvic. So we can improve, but otherwise we have a lot of equipment that we can use to monitor oxygen perfusion. Then the other thing here is that the patient should be put in balanced position if it can be tolerated, because it helps in maximum lung expansion. You can see that when I was giving you the nursing intervention, I was also putting the rationale here, and we have a column for rationale. You can have a lot of intervention, but yet have just one rationale. So mostly in my writing of nursing care plan, I try to merge nursing intervention with rationale. All right, then the next part there is evaluation. What are we trying to evaluate? You are trying to evaluate whether the objective has been met. What is our objective? To increase oxygen perfusion. And when talking about evaluation, it can be formative or summative. Summative at the end, formative within the program or within the process. So now we want to see what has come out after all our intervention, meaning we want to look at our summative evaluation. So it's going to be in past tense because the problem has been solved. Our objective was to increase oxygenation within 30 minutes. Hence, if that is achieved, the patient will start breathing normally. So patient will start breathing normally. You can also give us with respiration of what are the normal ranges for respiration? 18 to 22 or 18 to 24. You can give us that range there. Because you're evaluating and now you're giving us the parameter or the principal indicator of why you feel that has been satisfied. Okay, all right. The other part necessarily that when I started this lesson about the nursing care plan that I did not necessarily expand on do with the nursing process are the steps. Because these steps are translated within this nursing care plan. Assessment. When are you doing assessment? You are doing assessment to come up with a problem. You are doing assessment to come up with a diagnosis. So we have assessment. During assessment, you can get subjective and objective data. Okay? All right. Then there is planning. After planning, you come up with objectives. So we have the objectives here in our nursing care plan. Okay? Then you would have seen that we have 4 steps, 5 steps, 6 steps, and 7 steps, 8 steps. I don't know which generation you're living in. But otherwise, mostly we look at 5 and 6 steps of the nursing care plan. So there is APIE, that is assessment, planning, in planning, intervention, and evaluation, or ADPI, assessment, diagnosis, planning, intervention, and evaluation. And then we have also, you can also look at the planning process or the nursing process, ADOPI, that is assessment, planning, outcome identification, assessment, diagnosis, outcome identification, planning, intervention, and evaluation. I said others to emphasize on assessment, they may split it. So it will be assessment analysis, and then you add in all those. And remember, in nursing, we have a saying, if it is not documented, then it has not been done. So others, they also try to add documentation within the nursing process. But I just want you to remember the 5 steps there, or the 6 steps, that is add pi or add pi within the nursing process, in case you face that question. Okay, I hope this discussion has been fruitful in helping you to understand the nursing care plan. Remember, get the subjective data, know the stem of the question, know the condition that you're looking at, and then identify the problems. When you have identified the problems, write the problems that you have identified, and then start putting them on your nursing care plan. Then that way you're going to help the patient, and the nursing care will be superb. All right, so it's the year of the nurse, 2020. It's my small way of giving out to people out there so that they understand some of these lessons that we may have been finding challenges with. So I encourage you to share so that a lot of people can learn something from this, if at all you have benefited. I'm encouraging feedback so that the next lessons can improve on these lessons that we are recording now. These videos are created so that we assist visual learners understand the lessons that may be difficult to understand when you just read the information within the books. And I'm encouraging you to say, after the recording of this lesson, check out on my Facebook page. I post the notes of each and every discussion that I have with you on our YouTube channel. So you check out those notes on Jones Muna. I have a lot of pages there where I post the notes. You can check out these notes and they'll give you a deeper understanding of each and every topic that we have been covering. I thank you most sincerely and continue supporting us by subscribing and sharing these lessons. Otherwise, ciao.